Psoriasis is a skin condition that persists and is often not well understood. It affects millions of people around the world. It causes skin cells to accumulate very quickly. As a result, thick silvery scales and red patches form that are dry and cause itching. These areas can be painful and may appear anywhere on the body, most commonly on the elbows, knees, scalp, and lower back. It is not equally severe for everyone. Some people experience only mild discomfort, while others have symptoms so severe that they affect their everyday life. Psoriasis is not just the marks we see on the skin. It deeply affects our quality of life. Many people feel sadness, shame, or that they are alone. Constant itching can ruin sleep and make it hard to concentrate, making our lives more difficult. Psoriasis is a somewhat complicated disease. Our own body creates an inflammation that doesn't just stay on the skin, but affects other areas as well. This inflammation is not limited to the skin. It also affects other parts of the body. Because this inflammation is systemic, psoriasis can also be linked to other serious health problems. To address it properly, we need to do many things together, as a whole. A common complication is psoriatic arthritis, which causes pain and swelling in the joints. Psoriasis is also associated with a higher risk of heart disease and metabolic syndrome. It is very important to pay attention to these complications in order to manage psoriasis better. Omega-3 fatty acids are valuable fats. We need them for our brain and heart, and they help a lot with inflammation. There are three main types: EPA, DHA, and ALA. EPA and DHA are found mainly in foods from the sea, while ALA is found in plant-based foods. Fatty fish such as salmon, mackerel, sardines, and tuna are rich in EPA and DHA. For those who don't eat fish, one solution is fish oil supplements. Plant sources of ALA include flaxseed, chia seeds, walnuts, and hemp seeds. Omega-3s help with conditions like psoriasis because they fight inflammation. These good fats, omega-3s, are like fighting against the substances that cause inflammation. They help reduce these harmful substances and create others that calm inflammation. This action is very important for chronic inflammatory conditions such as psoriasis. If we incorporate omega-3s into our lives, we can help our bodies regulate inflammation, thereby reducing the severity of psoriasis. Omega-3s also help with overall inflammation in the body and can therefore reduce other health problems related to it. Scientific research shows that omega-3 fatty acids help in managing psoriasis. The studies mainly look at how EPA and DHA can reduce the severity of psoriasis. People who take omega-3 supplements or eat more fatty fish often see encouraging results. Clinical trials show a reduction in redness, scaling, itching, as well as the extent of affected skin. Doctors who monitor psoriasis often observe significant improvement when patients take omega-3. Omega-3s also reduce markers of inflammation in the blood, calming inflammation that exists deep within the body. This overall effect is very important as it helps not only with skin symptoms but also with other health issues that may coexist. Omega-3s are like a good assistant. They do not replace your doctor's treatments, but they make them even better. It's a good idea to talk to your dermatologist about using omega-3s so you can properly incorporate them into your overall treatment plan. All studies agree that omega-3s have a positive effect on inflammation. They offer natural support for those living with psoriasis. If you incorporate omega-3s into your life, you may generally feel better and your treatments may become more effective. To incorporate omega-3s into your lifestyle, you can start by making some small changes to what you eat. Try to eat fatty fish at least 2 to 3 times a week. Good options include salmon, mackerel, sardines, and herring. For those who are vegetarian or don't like fish, plant-based sources of ALA are important. Flax seeds, chia seeds, walnuts, and hemp seeds are excellent sources of ALA. Omega-3 supplements such as fish oil or algae oil help us get the amount we need. Always consult your doctor before starting any supplement, especially if you are taking other medications. When choosing supplements, pay attention to their quality. Check how much EPA and DHA they contain, and if possible whether they have been tested by an independent organization so you can be sure. To help with inflammation, experts usually recommend taking 1 to 3 grams of EPA and DHA combined each day. But always consult your doctor. Follow your doctor's advice regarding the correct dosage and how long you should take them. Small changes in your diet can make psoriasis symptoms milder and improve your overall health. Guidance from a specialist ensures that what you are doing is safe and effective for your particular case. To manage psoriasis, it's not enough to just take care of the marks on the skin. We need to do many things at the same time. An approach that combines everything: the doctor's advice, changes in our diet, and adjustments to our lifestyle, brings the best results. Omega-3s are a valuable part of this approach as they help soothe the skin and address inflammation throughout the body. It is very important to be well informed about psoriasis and the ways to manage it. Discuss with your doctor about supplementary treatments that can help, such as omega-3s. Omega-3s help reduce inflammation throughout the body and thus may also lessen other health problems related to it. By incorporating omega-3s into your life, you support your overall health and well-being. When we actively care for our health and look for things that can help us, managing psoriasis becomes easier. Omega-3s offer a natural way to reduce inflammation and make symptoms milder. Learn more about omega-3s and talk to your doctor or the healthcare professional who is treating you. When we know what to do and follow a comprehensive approach, our quality of life improves. Your health is worth every effort.